These are some rapid fire tips for things that new nurses should always be aware of. So if you're a new nurse, make sure you save this because this is going to save your butt. Anytime your patient is getting Lasix, always go and check their morning labs to check their potassium level. Lasix depletes the potassium, and so if your patient already has low potassium and it has not been replaced, that most likely needs to be addressed before you give the Lasix. Whenever you go to give your patient any sort of antihypertensives, always make sure you have a recent blood pressure and heart rate. Most antihypertensives should have hold parameters on them, but not everyone does. So make sure you double check the patient's blood pressure and their heart rate before you give any of those medications, and always clarify with the doctor if they want any sort of hold parameters. If your patient has a feeding tube and you are administering medications that you need to crush through that feeding tube, make sure they are not extended release medications, because you cannot crush extended release medications because then they are not extended release anymore. Whenever you go to empty your patient's Foley, double check how much urine output has occurred in whatever time frame since it was last empty. The patient should be putting out at least 0.5 mils per kilogram per hour of urine. If not, then definitely touch base with the provider to let them know about the low urine output unless this is expected for this patient. Before you give your patient any sort of blood thinner, I'm talking about aspirin, Lovenox, Xarelto, Coumadin, Eliquis, etc., always think in your head, does this patient have any sort of procedure today that may require me to hold this blood thinner? In a perfect world, it is always ordered to hold the blood thinner or de-seed off of your MAR, but we don't live in a perfect world. So I always like to make sure my patient doesn't have any sort of surgery or procedure that they may need their blood thinner held for, and I will clarify that with the provider before I give it to them if so. Okay, let me know if you want more of these tips and tricks because I could go on forever.